Hello, Annette here again. Welcome to this lecture on family planning. Although sex evolved as a means to reproduce, human beings have throughout history looked for methods to prevent pregnancy resulting from sexual intercourse. As far back as 1850, before Common Era, we find evidence of Egyptians applying a combination of honey, acacia leaves, and lint postcoitally as a method of contraception. Contemporary contraception, or the methods and techniques we use to inhibit conception, offers a broad range of effective choices that are based on modern medical science. In this lecture, we will review the different categories and kind of contraceptions that are available today. There are essentially 4 different types of contraception. Firstly, there are barrier methods. These are mainly condoms and spermicides, and these are the only methods that can also provide protection against sexually transmitted infections. Secondly, we have a range of hormonal methods for women. These methods provide contraception through provision of 1 or 2 different hormonal substances and thereby impede fertilization of the ovum. Thirdly, there are intrauterine devices. These are inserted into the uterus of the woman and is a reversible form of contraception. And lastly, we have surgical methods for women and men, and these methods are in principle permanent. Especially the hormonal methods continue to develop, both in content and means of administration. Some of the most known are contraceptive pills, hormonal injections, and subcutaneous implants, but there are also contraceptive patches, hormone-releasing vaginal rings, and hormone-releasing intrauterine devices. Currently available hormonal methods are all intended for women. Research on male methods is underway, but there is nothing on the market right now. We can divide available contraceptive methods into short-term methods, which are pills, condoms, and injections, and long-term and permanent methods. The long-term ones are intrauterine devices and implants, and the permanent ones are various types of surgical sterilization. One very important aspect is that both contraceptive effectiveness and cost effectiveness are much better for the long-term and permanent methods than for the short-term methods. It is important to know that 2 different contraceptive methods can be used after unprotected intercourse. They are both called emergency contraception and sometimes day-after methods. One method is by a hormonal pill, and the other method consists in inserting an intrauterine device. Making these methods widely available is extra challenging, since the woman or couple will not seek any of these methods in time if they are not well informed about their existence. In many countries, information on these methods has been withheld by the health system in the belief that people would behave irresponsibly if they were made widely available. In many other countries, they are widely available, including over-the-counter sales without prescription for the hormonal method. And this actually works very well and contributes greatly to reducing unwanted pregnancies and abortions. Apart from the condom, all of today's contraceptive methods have been developed in the past 60 years, and we have a large body of knowledge about them. Every method has its own characteristics, including its specific contraceptive effect, and oftentimes also non-contraceptive effects. Contraceptive counseling is therefore an important task, and the provider should of course know the ins and outs of the different contraceptive options that are available locally. The contraceptive needs of the individual woman or man can vary based on her or his current life situation or any relevant medical history. This needs to be checked before the options are presented for discussion. For example, combined oral contraceptives, which contain estrogen hormones, should not be used by women who have a history of deep vein thrombosis or blood clot, and also not by women with history of certain types of cancer. High blood pressure is also contraindication for this method. But when provided for the right individual and correctly used, both hormone contraceptives, intrauterine devices, and surgical sterilization provide a high degree of contraceptive safety, in combination with a relatively low degree of unwanted side effects. Most side reactions are reversible, like bleeding, irregularities, or symptoms like headaches or breast tenderness. Again, careful counseling before starting up a new method and at the follow-up session is essential. Overall, it is important to remember that contraceptives are methods we use to have a safe and good sexual and reproductive life. And we as users will be less tolerating of side effects than we would be of a medication for a life-threatening disease. On the other hand, most people give a very high priority to being able to access effective and safe contraception and to be able to plan when and with whom to have children. From a development perspective, family planning is a fundamental, very cost-effective intervention to promote women's and children's health, women's empowerment, economic growth and development. It is a core component of sexual and reproductive health and rights.